I'm going to be performing manual muscle testing. This is to determine if there are any limitations or differences in the range of motion of the left or right sides, and to also use resistance to test muscle strength. These are performed by observing the range of motion of the specific muscles and then applying pressure against the muscle's movement. The range of motion will be demonstrated 5 times and resistance will be measured for 5 seconds on each side. The first muscle we will be testing is the extensor hallucis longus. The patient is going to be supine and with their foot on the table, and they are going to extend their big toe 5 times. 3, 4, 5. All right, he scored a 3 because he has full range. And next you'll grab the medial side and apply pressure, and 2, 3, 4, and 5. He scored a 5 because he performed well against resistance, and he will perform it on the other side. 2, 3, 4, 5. Perfect. Again, medial side and for resistance. 1, 3, 4, and 5. Great. He scored a 5. So the next muscle we'll be testing is the tibialis anterior, or for dorsiflexion. They will be seated with their feet a little off the table. Great. And they will put their foot up against towards them. So if you could do that 5 times, please. 4 and 5. Perfect. Now to add resistance, we'll just grab the lateral aspect, and if you could do resistance, please. 2, 3, 4, and 5. Great. Scored a 5. You can perform it on the other side, please. 2, 3, 4, 5. All right. Perfect. And if you could resist. 1, 2, 3, 4, and 5. Great. He scored a 5. Next, we will be testing the gastrocnemius, or for plantar flexion. Again, they will be seated, ankles off. If you could go like you're pressing the gas pedal, please. 1, 2, 3, 4, and 5. Great, that's a 3. And now we will apply some resistance. So go. 1, 2, 3, 4, and 5. Perfect. That is a 5 out of 5. And if you could please perform it on the next side, please. 3, 4, and 5. Perfect. If you could go against resistance. 2, 3, 4, and 5. Perfect. He scored a 5 on that one. Next, we will be testing the peroneal longus, or the fibularis longus, which is eversion. They will be on the side not being tested, so we are going to test the left side first. So he's going to be on his right side. He's going to put the lateral aspect of his foot and point it towards the ceiling 5 times. 3, 4, and 5. Perfect. Now you could go against the resistance, please. 2, 3, 4, and 5. Perfect. He scored a 5. Next, he's going to change sides and do it 5 times. 2, 3, 4, and 5. Perfect. You could go against the resistance, please. 2, 3, 4, and 5. Awesome. He scored a 5. Next, we are going to be testing the tibialis anterior, which is inversion. So we are going to have him on his right side first, and we're going to be testing the side that's on the table. So he's going to point his medial aspect of his foot up towards the ceiling 5 times, just like that. 2, 4, and 5. Perfect. Next, if you could do it against some resistance. 1, 2, 3, 4, and 5. Great. He just scored a 5. Next, he's going to go on to his other side. All right, 5 times, please. 1, 2, 3, 4, 5. Perfect. If you could go against the resistance, please. 2, 3, 4, 5. Perfect. You just scored a 5 out of 5. And next we are going to be testing the quadriceps femoris. This is for knee extension, so you're going to have your patient seated with their knees at 90 degrees. Perfect. And you're going to kick up 5 times and extend your knee. There you go. 2, 3, 4, 5. Awesome. So for resistance, you're going to place your hand right here and have them extended, and they're going to go against the resistance. 1, 2, 3, 4, and 5. Perfect. Now he's going to demonstrate the other side. 2, 4, 5. All right. And for the resistance, ready? 1, 2, 3, 4, and 5. He just scored a 5 out of 5. And last but not least, we are going to test the biceps femoris, semitendinosus, semimembranosus, which is knee flexion and hip extension. So the patient is going to be laying prone, so their stomach's going to be on the table. And for this, they're just going to bend their knee and do that 5 times. 2, 3, 4, and 5. All right, that is a 3. Next, to test, we will have one hand on the lower of the back, and for the other hand to be right on about their calf level. And if you could go against the resistance, 2, 3, 4, and 5. Great. Scored a 5. And next, if you could do the other side, please. 2, 3, 4, 5. Perfect. You just scored a 3. And we will do the testing again. Ready? Go. 1, 2, 3, 4, and 5. Great. And you just scored a 5 out of 5. This has been manual muscle testing demonstrations of the lower extremities